Dr. Vandivier is a professor of medicine and director of the COPD program at University of Colorado Anschutz Medical Campus. He attended Indiana University School of Medicine and completed his residence in internal medicine at St. Vincent's Hospital and the Medical Center in New York City. Critical care medicine at National Institute of Health and Pulmonary Medicine at University of Colorado Hospital. He investigates ways to identify COPD before it can officially be diagnosed and how to optimize delivery of care. And I'm just going to say, he's just a very, very nice guy. Brilliant and a very, very nice guy. So please, come on up, Bill.
Thank you very much. It's really, really a great honor to come here. I gave a talk here 20 years ago or so, or something like that, and so I just have known for a very long time that this is a really important conference. And so, first off, I want to thank all of you for coming. My understanding is that a lot of you are coming from really all sorts of, all different parts of the state. And that's no minor thing. So thank you for coming. First off, I want to thank Alan and Donna for inviting me, and I want to thank Tom Petty for really kicking this off years and years and years ago. So what I'd like to do today is I'm going to give you just a little bit of an outline of the plan. I'd like to talk about COPD, and then I'd like to talk about smartphones and how you can use them if you want to help improve your health. And then finally, we'll talk about using wearable monitors, which usually interact with your smartphones. Now, there are a lot of different phones out there. There are a lot of different wearables, and I know something about COPD. I know something about my own phone. I know a little bit more about some of these wearables. But if you have a particular phone, if you have a wearable that you're using all the time, you're going to know a whole lot about that. And so what I did in putting together this talk as best I could is not to fill it up with me, not to fill it up with a whole lot of slides, and hopefully get to a point where we can have a discussion. Because a lot of you are really experts with your own phones, and I think that we would really all learn a lot by having a discussion at the end. So I'm going to try to make that happen, and people can pull me off the stage if I'm taking too long up here. So, and then the final thing to say before I get started is that I think what we're going to talk about today is relevant for lots of different people and lots of with and without illnesses. I'm focusing on COPD, but what we're talking about could be relevant for any single disease, and I think that's good because not everybody has COPD in the audience. It's relevant for family members to help keep an eye on loved ones, and I think it's even relevant for people who don't have disease at all in thinking about how you can use these things. Now, also, I'm well aware that not everybody in the audience has a smartphone, and some people have flip phones, and that's perfectly okay. I still think you can get something out of this too, and you might think maybe I'll get a smartphone after this, or maybe not. My 13-year-old son still has a flip phone because we have not allowed him to have a smartphone yet, and I have a love-hate relationship with my own phone. So I understand it if you actually don't want one of those. So with that, I think I'll go ahead and get started. So this is my only disclosure. I'm part of the medical advisory board for health grades. Next. And we already talked about this. Okay, go ahead to the next one, would you please? All right. So I'm going to talk, like I said, a little bit about COPD just to start off, and just to bring everybody up to the same point. So COPD, as we all know, is primarily caused by smoking, which you can see up there on the slide. And amazingly enough, we still have 1 billion smokers in the world, 1 billion smokers. So we still have a lot of problems related to that, both COPD and non-COPD. But smoking, next please, just smoking is not the only cause of COPD. And in fact, as you can see up there, 25% of COPD is not caused by direct smoking. I'll repeat that, 25% of COPD is not caused by direct smoking. It's caused by other exposures that we get in other environments. And one of the exposures that's really quite common is secondhand smoke exposure. And people still today think that secondhand smoke exposure is not so bad. But it is, and it can cause chronic symptoms. It can cause COPD. And one of the things that is amazing to me is we have 1 billion smokers in the world, so that's 1/8 of the world's population, and we have 2 billion people who are exposed to secondhand smoke. So for every smoker, 2 people are exposed to secondhand smoke. So that's 3/8 of the world's population is getting smoke exposure in some form or another. Next, please. So there are other causes of COPD, and you can think about these causes as causes associated with fine dusts or fine particulates. And those fine dusts get caught in your airways and cause problems that I'm going to show you in just a minute. And one of the big ones around the world are what are called biomass fuels. It just simply means that people are cooking inside the house and there's a lot of smoking in the house. And you find that lots of places, but you don't really find that here in the United States very much. Next, please. So there are other causes. Here's one, agricultural dust. So if you live out on the eastern plains or in western Kansas or Nebraska, or you're on the western slope, and you're in agriculture in some way or another, you're getting exposed to these dusts all the time, and they can cause COPD. Next. Dusts from other industrial sources. Maybe you're a carpenter, maybe you're working in a mine. You can easily be exposed to dust that by itself can cause COPD. And next. And the final one is pollution that we all deal with to a greater or lesser extent. Now, all of these can kind of combine together. So you can be a smoker and you're getting other people's secondhand smoke exposure, and you're working in a factory where you're being exposed, or you're working out in the farm where you're being exposed. All those come together to cause COPD. Now, COPD causes a lot of symptoms. Now, those symptoms are indistinguishable from other types of lung diseases, so you have to look into a little bit more. But one of the most common symptoms is shortness of breath. Next, please. As you can see right here. And so this shortness of breath that people have is really at the center of it caused by damage to the lungs, which we can look at in a number of different ways. Next. So I don't have a pointer, but I think you can see it. These are small airways on the left from a normal person. And what you can see is the wall of that airway is pretty thin. It has a nice ring of kind of purplish epithelium. And then the very center of the airway is kind of a wide open space that air goes into and comes out of. But when you have COPD over on the right, good, thank you. We're a team now. Over on the right, now it's very different. Now you've got airways that are filled with inflammatory cells. So you have all those purple cells in the wall. The wall is thickened. The space the air is supposed to go in and out of is narrowed and narrowed and narrowed. And that's one of the primary ways, causes of shortness of breath, and because it's hard to get air out. And really that's how we end up diagnosing COPD. Next. Now, around those airways is lung tissue. And then lung tissue are the little sacs, the alveoli, where you exchange oxygen and carbon dioxide, and you all know about that. If you were to take a person's lung and take all those alveoli and open them up, you would have a surface area of about a tennis court, which is pretty amazing. And that tennis court of alveoli is what allows you to exchange those gases. But when a person smokes or gets exposed to all the things that I just showed you, they can, not everybody does, but they can get destruction of those alveoli. So now instead of a lot of small balloons, you've got some big balloons. And what you can see on the left side is a normal lung filled with pink tissue. And what you can see on the right is a lung that is not filled with pink tissue anymore. It's filled with a lot of whiteness, and that whiteness is air because the lung has been destroyed. Not only do you see that, but if you look at the size of the two lungs, you'll see that the COPD lung there on the right is larger. And it's larger because air gets trapped inside the lung. COPD is a disease where it's hard to blow air out, and as it gets harder and harder to blow air out, the lungs get bigger and bigger and bigger. And I'm going to talk about that a little bit more in just a minute. Now, we, as healthcare providers, can look at this in a number of different ways. But probably the best way to look at it is with a CT scan. And if you do get a CT scan and you sit down with your medical provider, ask to look at it, because I think it would probably be revealing to you. It's always nice to see it and to have somebody explain something to you in person. But so on the left is a normal CT scan. And the way these are set up is things that are not very dense, like air, are black. Things that are very, very dense, like bone, are white. And then everything is a shade of gray in between. So if you look at the lung, you can see the right lung and the left lung there. The lung is gray. And the areas of whiteness in the lung are blood vessels, and they're filled with blood. And that blood is actually more dense than the lung itself. So as somebody gets emphysema, they get lung destruction, then that lung starts to become blacker and blacker and blacker, meaning that's becoming more of the density of air because it's filled with air, just like I showed you before. And you can, hopefully you can see that. I'm not sure how well it projects up here, but that's an example of emphysema, which typically occurs in the top of a person's lung. Did I do that? Oh, so I don't know if that's what kind of a sign that is. So we need to get the Huff and Puffers to play a song now. So okay, so that's emphysema, and so then let's go over the next one. So now you can see those lines are pointing toward thickened airways, which is what I was trying to show you before, but this is on a CT scan. Okay, next now. Okay, now all of those things I just showed you were all related to shortness of breath. And so how do they ultimately cause shortness of breath? And so what you're seeing here is you're seeing a finger pulse oximeter. And I'm sure probably everybody in this room has seen them or has them and uses them on a regular basis. And so most people think that low oxygen is the most common cause of shortness of breath. And the reality is that while it's important causing shortness of breath, it's not the most important cause of shortness of breath. Next slide. So this is an X-ray of a normal person that he's showing you right here. And what you can see is that at the bottom, you see the outline of the diaphragms. And they're kind of rounded like that. That's the normal form of a diaphragm. And this is the normal size up and down of a lung. When you get COPD, next slide please, and you get this air trapping, now what happens is air fills up and fills up and fills up the lung. The lungs get taller and taller and taller, and the diaphragms get flatter and flatter. And so now, instead of breathing like you would normally breathe, it's as if you took a big deep breath, and now breathe on top of that. Now that will cause shortness of breath. And the other way it causes shortness of breath is when you exercise and you breathe quickly, you aren't leaving enough time for that air to get out of your lung because you're breathing quickly. And so that overinflation will get bigger and bigger and bigger, and you'll get more and more shorter breath. That's how you get so short of breath when you're trying to exercise. And when it comes down to it, though, that exercise that you're doing is one of the most important things that you can do. And the reason it is because when you get in good shape, then your respiratory rate goes down. When you get in great shape, you can walk and you don't have to breathe so fast. And that longer breath allows you to empty your lungs, and so you don't get a shorter breath. So activity, exercise, becomes absolutely critical. And it's also the hardest time to do it when you're really short of breath. Okay, next please. All right, cough, obviously. That's another common symptom that people have. And I come back to the pathology and to the airways that we saw. And so the inflammation in those airways is what causes you to cough. So that's another symptom. Next slide, please. But one of the most important symptoms, and one that I hear about all the time, is fatigue or lack of energy. Next. And that lack of energy is being caused because the problems in the lung are not limited to the lung. And in fact, you get inflammation throughout your whole body. And that inflammation causes the fatigue that you have. So shortness of breath, cough, and fatigue. Okay, next, please. All right, so what are some of the treatments? And I'm just going to go over them just a little bit before we launch into talking about smartphones and things like that. So pulmonary rehab is to my way of thinking, is the most important therapy that you can have. It's hard because you have to go there in general, but pulmonary rehab is important because of a number of things that are covered. Go ahead, Alan. So education on COPD, like we're doing here. Somebody to show you how to use your inhaler. And unfortunately, a lot of our offices, and ours has been this way also in the past, are not really set up to take the time to show you how to use the inhaler. But if you can't get that medication into your lungs to the right spot, it's not going to work very well. So inhaler teaching is critical. And then also to learn about COPD flares or exacerbations. That's a really important piece that you'll get in pulmonary rehab. Exercise training, strength training, and endurance training, and it really gets at what I was just talking about with decreasing your respiratory rate. Next, please. Oxygen, rest, with sleep, with exertion. Really, really important, and they'll optimize that when you're in pulmonary rehab. Next. And then a network, a support network. You're getting a support network today by coming here and talking to people. You get a support network when you're in pulmonary rehab. You'll get a lot of information that way, and you'll be empowered to go ask your physician questions that you may not be otherwise. Next. All right, Tom Petty was really the pioneer of oxygen in this country. Otherwise, it was also pioneered in England pretty much at the same time. But Tom Petty really was our rock star here who did this. And so as you can see, there are a lot of different forms of oxygen. Unfortunately, there's not much liquid oxygen anymore, and that's really unfortunate because I think that really helps people become more mobile and get out and do things. But if you can, if you have a portable oxygen concentrator, that does the same thing. It allows you to get out. It's very hard to do that when you have big tanks. But oxygen therapy is super important. Next one. All right, inhalers. We have the short-acting inhalers like an albuterol. Those are rescue inhalers that you use when you're having symptoms. Long-acting bronchodilators, like Spiriva or Ceravent or things like that. They're long-acting forms in general, of the albuterol. And then the third would be an inhaled steroid. Now, I'm not going to go into any detail with this because Dr. Vandivier is going to go over a lot of good stuff in just a little while, and I'm going to leave that to her. Next. And vaccinations, flu, go ahead and do that next. Flu, pneumonia vaccinations, there are several up there. COVID, and the new RSV vaccination. So if you haven't had these, please get them, especially the COVID and the new RSV vaccination. They're really great. Next. Okay, now let's talk about smartphones here. So again, like I said before, people have many different kinds of smartphones. I'm not an expert on all these different kinds of smartphones, and I have an iPhone. So really, most of what I tell you about is going to relate to my iPhone. But we have a lot of resources at the end, so you can go and get more information on what your particular phone has. Some of the Android phones don't have all the pieces that you might find in an iPhone, but they have apps that you can go to basically do exactly the same thing. So how can you use smartphones to help yourself? Well, you can do it to monitor yourself and to set goals. That's probably the most important thing. And the next thing is to detect a problem. So let's say if you're getting an exacerbation, if you're having an increase in symptoms and things like that. Next, please. Okay, so I'll give a disclosure that a lot of the data you're going to see is personal protected health information from Dr. Vandivier, and I've signed the release so you can all take a look at it. You may end up learning more than you want to about me, but you'll tell me that afterwards. So if you open up the health app inside an iPhone, you'll see a whole bunch of different things. The list up there of what you can do. Some of it I have highlighted, like activity and mobility and symptoms, and that's really what we're going to talk about. Other things like respiratory rate or heart rate really require an external wearable device of some sort to measure those things that then populate your phone. Either populate your phone in an app, or if you have an iPhone and an iWatch, it's nice because it populates straight to these sections of the iPhone. And I'll say one thing else I'll say too is that these phones are expensive, and I recognize that can be a real impediment to people doing these kinds of things. They're very expensive, but you don't need the newest, fanciest Ferrari iPhone, to get all these things. You can have several generations back and be able to get into the what I'm showing you right now, and be able to connect to the resources I'm going to show to you, and also to connect to these monitoring devices that we'll talk about. So you can get something that's a whole lot less expensive. Okay, next. So here are some data that, let's say you want to look at activity. And activity you can look at it a number of different ways. You can look at it as steps. You can look at it as energy expenditure, or you can look at it as mileage that you do per day, per week, per month, things like that. Those are all the same thing. So you just decide what it is you're interested in following, and a lot of people will follow steps, and that's what I'm going to show you right here. But you can do any single one of them. Now you can look. Question? Yeah, there is, and we have some resources at the end where you can pull those kinds of things down. Yeah, so it's not just about an iPhone, but that's the data that I have to show you today. Yes, question? So that's a great question. So if you go and you look up normal steps per day for your age range, you'll find that on the internet, normal steps per day. And a lot of people will say 10,000 steps a day, or as you get older, it's in the the 7,000 to 8,000 range, things like that. I actually don't think you should pay any attention to that whatsoever. I think you should start to track yourself and start to see what you actually do. I think that's wonderful. But everybody's going to be a little bit different. Some people are going to get 2,000 steps a day or 1,000 steps a day. Some people might be 10,000 steps a day. But just to finish off, I think you should make your own goal and make sure it's a goal that's achievable, and then slowly work your way up. That's the key, I think, to this. So you can see daily steps here. It's today versus yesterday. You can see the graph below, which shows what I was doing that day compared to what I usually do, which is the line below that. So you can see it. You can see weekly what I was doing this week compared to last week compared to the week before. Over to the right, you can see what I was monthly this month compared to last month. And then at the bottom, you can see what I did this year compared to what I did last year. Now, if you look at it carefully, you'll see there's a lot of variability in the daily, in the weekly, and then as you start to get into the monthly, and then the yearly, there's a lot less variability. That's because it's summing, averaging data from a lot of data points over that particular period of time. So you have to decide how you want to do your goal, but I think probably a weekly or monthly, trying to increase maybe by 100 steps or 500 steps or whatever it is that you can do is a good way to do that. And so finally, I think what you can do is set your goals like what we've been talking about, and then monitor that progress and see the success. Next, please. Okay, mobility. This is another key thing that I think you can get out of your iPhone. Now, to get the data on an iPhone, just like to get the data that I just showed you, you have to have it in your pocket, which you may or may not do, and we'll get to the wearables in just a minute. But mobility is really, really important because as you don't do things, as you pull back because of your shortness of breath, then you get weaker. And then you're prone to having things happen like falling and getting a break, which nobody wants. So this is the way to help monitor that mobility. So one of the things that you can find on your phone is called double support time. Double support time is just like I'm doing right now. I'm standing here on both legs. And the more time you stand, in general, can indicate that you're weaker or your balance is off because you don't really want to move. I'm just going to stay in a standing position all the time. So if you've got a double support time over 40%, then that might be an indication that you have an issue. Okay, so next is walking speed. So walking speed. So the faster you go, usually the stronger you are. And so you can, again, make a goal for your walking speed. And let me go a little bit faster. You don't have to do something like that, but the more time you spend walking faster, the less you're just spending on your legs, so your double support time actually goes down. Okay, double support time, walking speed. The next is what's called walking asymmetry. And basically, you can just think of somebody limping along, and they might be strong on one side and weak on another, or a little bit imbalanced. So that walking asymmetry is usually not a good sign. It's something you actually want to work on. And so you want that to be as low as it possibly can be. Now, if you look at that graph, my walking asymmetry is pretty low, which I'm not sure why, because I have a little bit of a limp. But then all of a sudden, bam, it went up there. And so why did it go up? Did something happen to me or something? What was it? Well, what it was, I took my dog out for a walk and I played with my dog in the yard, and I went and I looked at my app and wow. So it doesn't always mean a problem. Sometimes it can mean you're out having a little bit of fun. Okay, next please. Now, all three of these measures get put together in an iPhone in walking steadiness. And it's their own algorithm how they do that, but you want a walking steadiness that's high. And it grades that, you probably can't see it, but it grades it in categories of what your walking steadiness is. So that's how you can really monitor your mobility. Okay, the next one. Okay, now symptoms. So we don't really have, we might have a monitor out there now that can monitor symptoms. I think that there's one, but I don't know that for sure. Symptoms you have to add in. And I'm just going to show you how you can add in symptoms with this phone. And again, you should be able to do the same thing with an Android and monitor your symptom progression. And so, for example, let's take shortness of breath. And so you can see on the left, shortness of breath is up on the top. But there are many, many symptoms, and I don't have all of them on there, but it can be cough, it can be phlegm production, it can be abdominal pain, it can be leg pain. Whatever your symptom is, you can add it in. And then every day, you can say something about it. Next. And here's where you add the symptom. And then as you can see, you can say it's not present, it's present, it's mild, moderate, or severe. And then at the bottom, you can say, okay, I had it for this period of time on this day or over several days or whatever period of time you had those symptoms. And now go to the next one, would you, Alan? Yeah. And so I just put these data points in so you can see how it can be used. So you can see how my symptoms were, I think, present, and then they increased, and then the last day, the symptoms were a little bit longer. And so if you're really doing this just once a day, what are my symptoms doing? Then you can keep track of the normal ups and downs. So if those symptoms get worse, you can really see it, and it'll tell you, gosh, this is time for me to call my provider and let them know I've got something going on. You can use this to detect problems for yourself. The problem with it is you've got to do something, and doing something is hard when you're trying to do everything else in your life. Okay, next, please. All right, so what else can you do with your smartphone? You can go out on the internet and you can find apps that you can use. I'm going to tell you about one app that I think is a really good one that comes from the COPD Foundation. Now, you may know of a bunch of other apps that are just great, and that's part of the discussion I hope we can get into. But this particular app from the COPD Foundation has two views. The view you're looking at on the left is the patient view. That's the one that you would probably go to first. Next, please. No, I'm sorry, go back. Yeah, but there's also a provider view. And you can, if you look up at the very top, there's a change view button. So you can look at the patient view, or if you're interested and you want to know even more about the medications you're taking and things like that, then you can actually change over to the provider view. There's nothing to stop you from doing that, and you'll learn more, but you don't have to do something like that. Okay, next. So on the patient view, what can you do? You can fill out some questions for an action plan. Next, please. Yeah. Just keep it like that. So on the left, there are a number of questions. There's a green bar, a number of questions under that. There's kind of a yellow-orange bar, a number of questions under that. And then there's a red bar down below, which you can't see, a number of questions under that. So these questions are about cough, shortness of breath, how you're feeling. And so if you're really not having any problems and you're in the green zone, then you don't have to do anything. You just keep taking your medication. If you start to answer some of the questions in that sort of yellow-orange zone, then the system will say, okay, you should tell your provider what's going on, but keep taking your same medications. And then if you get something that's in the red zone, that's really a problem. And so you've got to call your provider, or maybe do something even more, just depending upon how severe it is. But that's your action plan. What are my symptoms today? How am I feeling today? What should I be doing? Or should I make any changes to that? Now on the right, there's goal setting. Goal setting. So this has to do with all the activities you might do during the day and how limited you are with those activities, or you're not limited, and what you'd like to get to. So all of us, are limited in some way or another, depending upon the level of disease. And your goal might be from not being able to, what are my categories up there? I can't see them. Wish I could see them. I forgot the categories. Cleaning, making bed, and brushing teeth. Yeah. These would not be any of my personal goals. Again, it may be too much information for you, especially that brushing the teeth part. But let's say you can't clean and you really want to do something. You say, okay, that's the change I want to make, and how am I going to get to that? And how am I going to get to it by my activity, by how I take my medications, and I'm going to talk to my doctor or my provider about that. Next, please. Okay, educational videos. Why don't you just do both of them? Yeah, there's nothing. Yeah, just the next one. Okay, so on the same site, you can do educational videos, and those are on how do you use your inhaler. If nobody's ever really shown you how to use your inhaler, or even if they did and it's been a while, every single inhaler type is on there. And so you can go and look at it and say, gosh, am I doing it right? And I think it's really super helpful. The other set of videos are exercise videos. Like you can ask, well, what should I do exercise-wise? I haven't been to pulmonary rehab, or I have a while back, and which one should I do? And it'll help you through that. And you'll have a video you can go to. Again, you might be able to find these other places, but I think this is a good central spot. Next. Okay, just go ahead and open up all those things. Yeah, that's better. Okay. Now, if you're short of breath and you don't move out of your home very much, you could easily have anxiety from that. Who wouldn't? And you could have depression from that. And both of those things can affect your ability to take care of yourself, which then is going to make things worse. So how do you assess that? How do you get an independent idea about that? And you may or may not want to talk to your provider initially. So within this app, there's an anxiety scale assessment, and there's also a depression scale assessment. You can just do those questions. There are 5 or 6 questions. And then it'll tell you, you are in this range and you're good to go. You're in this range. Maybe you should talk to your provider. And you're in this range and you should definitely talk to your provider, and you probably need to be treated with medications. And that only goes back to helping you take care of yourself. And so anxiety, depression. And then the final thing on this slide has to do with creating a social network. And again, this does it. You get it in pulmonary rehab. You can do it with Better Breathers. Many different places you can do it, but you can also do it online. And the COPD Foundation has a way to do that, and that's their COPD 360 that you can get out of this too. Okay, next please. All right, now we get to the wearables. How am I doing on time? That's it? Okay. I'm talking too much. Somebody should have hooked me, taken me off. Okay, so here are all a bunch of different monitors that one can use. Next, please. And so these monitors, are passive monitors, and they're wearable, and they follow activity, heart rate, respiratory rate, sleep quality, sleep oxygen. All that information will either download into your phone if you have an iPhone, or download into your app that you can take a look at. Now, how do you decide if this is a good one for you or not a good one for you? It's very individual. For example, you might care about sleep data. And if you're going to have sleep data, you have to have something that's easy to wear. It's not very big. The charge remains for a long time. On the left, you can see the Garmin VivoSmart 5 watch, very slim. The charge lasts 6 days, and it gives you really great sleep data. The Oura Ring is there. Again, the charge lasts 6 to 7 days and gives you great sleep data. Then you have the Apple Watch and the Masimo watch. Now, they're really good watches. They give you a lot of information, but the charge only lasts 18 hours for an Apple Watch and 24 hours for a Masimo watch. So that sort of limits your ability to use it 24/7. And then to the right is a little wearable tag from Spire Health that goes right onto your underwear. And the good thing about that one is once you put it on, you don't have to think about it anymore. That's really good. And the charge lasts for a year. So that's a really nice one. We'll talk about that a little bit more, but that one is not one you can just buy off the shelf right now, unfortunately. Next. Okay, now we're getting back to my data. So here's this sleep data from the Garmin watch. And so what you can see on the left panel is you see all those bars at the bottom. And what those bars are doing is showing you, well, that night was my sleep pattern for deep sleep, for light sleep, for REM sleep. And you can even see a little bar at the far right, well, which is that little slim bar is when I got up. It was when my alarm went off at about 5 o'clock in the morning, and I went back to bed. And fortunately, I got a little bit more REM sleep. It was good for me. Now, over that night, it's also testing oxygen levels. And you can see that yellow line that dips. And that's, you want your oxygen level to be above 90% all the time, even when you're sleeping. But you can see Dr. Vandivier had a really big dip in his oxygen level. What was happening? He was snoring. And his wife nudged him and said, "Would you please turn over on your side?" So you can pick up those kinds of things. So it's really nice to, or maybe not nice to see it. So then the next one is, what was your average oxygen saturation for a night? And that, I think, is probably the most important thing, because if you're averaging low, it's a problem, and you probably should be on oxygen at night. And this will show you. And if you go to a higher elevation, it'll also show you that too. So next. No, go back one, please. Okay, I'm going to finish out with this, and this is the Spire Health system. As you can see, you can take these tags and put it on your underwear. And don't worry, I'm not showing you my underwear. I have better taste than that. It attaches to the underwear, and that downloads into this Spire Health hub, and then it uploads to the cloud, and then somebody can see it. Your doctor or somebody like that can see it. And this is what I think the future is. To trying to monitor people, they have to do nothing. They just put something on. They don't have to put anything into their phone, and somebody watches them and tells them if there's a problem. Now, I was test driving this back in summer of 2020 during the beginning of the COVID pandemic, and I'll tell you a little story. So I finished clinic, and as I walked out of clinic one afternoon, I thought, I don't feel so well. That's probably nothing. By the time I got home, I thought, maybe I need to just lie down just for a few minutes. And so I did that, and then all of a sudden there were chills and all this kind of stuff, and I quickly went and put on a fresh pair of underwear that had my Spire Health monitor on it so I could capture what was going on. Again, probably too much information. I did that because I thought I had COVID. I was absolutely certain that I had COVID. I didn't even question it because I've been working in the COVID units, and it was before the vaccine, and it was actually pretty scary because I said to my wife, I said, "You don't have the passwords for all of our accounts. Let me give you a couple of passwords." And you think back, and it seems silly, but that's how it was at that particular time. So now what I'm going to show you what happened during the next 24 hours, and you can see how this system works. Okay, so this is a day-to-day view, and on the top you see those bars, and that's how many hours a day I was wearing it. And you can see for the first, beginning of, or late July, that everything that I was wearing it for about 12 hours a day. Now, if you go down to the second line, that's respiratory rate deviation, and the next is heart rate deviation. All that means is after it has a baseline, does your respiratory rate or heart rate go up 10% or 20% or down those? That's just one of the measures that they can do that I found to be very helpful on this. And you can see in July, it was below those thresholds. Those are alert thresholds, those lines going across. Next, please. Now, you can see where those arrows are for respiratory rate. This is the exact time that I started having problems that I was just telling you about. So my respiratory rate went up, and and you see those diamonds mean that there was a notification about that. Next, Alan. And you look below, and the heart rate went up, but it didn't go above that line. And simply because I didn't have it set at 10%. I had it set at 20% for no good reason. I was just playing around with the system. But you can see that it really went up. Now, the next slide shows the hour-to-hour view, and I can show you what happened overnight. Yeah. So again, you can see minutes worn. It was being worn 60 minutes per hour on the top. So I was wearing it all the time while I was asleep, obviously. And now you can see the respiratory rate and the heart pulse rate at the bottom. It's no longer deviation. You see the actual respiratory rate. And you see that my curve at the very top was above the average by a long shot in these. And then by the next day, go ahead to the next one. Yeah, go to the next one if you would. It's back to normal. So like I said, I thought I had COVID, but my COVID test was negative. I didn't believe it, but it's PCR. It has to be true. But no, I still didn't believe it. Because what else was wrong with me? So I got up in the morning. I was sitting down at our kitchen table, and my 13-year-old daughter says to me, she says, "Daddy, why is the back of your leg red?" Go to the next one. Now, you see that? That's what she saw. And I know what you're saying. Those are darn good-looking calves that doctor has. They're really nice. And I would actually agree with you. They are. But even myself, I don't look at the back of my leg all the time, and I had pain every place. And I didn't really know that I had an infection, but she made the diagnosis, and it was picked up by the system. Next. Now, how could one use this? Think about using this if you have COPD. Well, we know there are COPD exacerbations where you get flares and you need to be treated with antibiotics and steroids. And there are different levels of those things. Next. It'd be nice to be able to pick them up early, because just go all through this. And one more. Yeah. And so on the left, you can see that 1 of 3 COPD flares are not reported. So if they're not reported, they're not going to be treated. In the middle bubble, okay, of those that are reported, there's usually a big delay, up to 7 days from the time there really is an exacerbation to the time they're actually reported. And what that results in is results in a longer time for an exacerbation that's not treated promptly and more hospitalizations. So if one could use this to identify a COPD exacerbation, that'd be really great. But I want to emphasize that this is not just about COPD exacerbations. This is looking at physiology. So if you had a pneumonia, if you had heart failure exacerbation, if you had atrial fibrillation, if you had another infection, it would pick that up too. That's the power of this kind of thing. So go to the next one, would you please? Okay, so conclusions are that smartphones allow people to monitor themselves and really to set goals. And that's really important. You can do it with that. You can also access apps that give you more information. You can definitely do that. Now, you can also pair these smartphones with wearables and get a lot more data, in some cases too much data, but allows you to look into this a little bit more deeply, and especially if that is paired with somebody like through your insurance company or your primary care provider, where they can monitor it and identify a problem like I just showed you, all the better. And I think that's the future of where things are going to go. Next. Okay, here's the online resources that you should have in your packet. Next. Okay, so, and Alan nicely mentioned our survey. So Patty and Fernando are doing it, and we are strategically located over by the food. So we'll get you when you come by. But we're trying to learn, what would be acceptable for you in your given situation. Would love to hear your input. So if you can stop by there, we actually won't be passing it out. You have to go over there and then just sit down for a few minutes, but it doesn't take very long. So with that, I'll stop, and I apologize for taking too long.
So we have.
I actually have a wearable on right now, and it's a Fitbit, and it wasn't up there. But the Fitbit's really good. I sync it to my phone, and it tells me everything, my steps, when I need to be walking, like it keeps beeping at me right now to tell me I need to get up. The sleep schedule, I don't understand, but it's the same as the iPhone. I don't know how to read all that stuff, but it's actually the same as the iPhone.
So you have an Android?
I have Android, yes.
Okay, perfect.
Yes, but
And so the Fitbit is perfectly fine.
yeah,
You know,
yeah.
there's-
So I thought that was pretty cool, that it pretty much does the same thing that the iPhone does. And then you can get the Fitbits at Walmart. I mean, I got mine through the medical, like Medicare, so, but you can get them
That's
anywhere.
great. What's the cost of them? Do you remember?
The Fitbit that I have on now is $100, and it's just little. It's just a little skinny.
Yeah. So that's great. I mean, less expensive is good, especially if it's giving you the same thing that another more expensive system will do.
Yeah,
So that's great.
Yeah.
So you like it.
I like it. Yeah.
Okay. I think so. Did you say Medicare pays for it?
Yeah, yeah. The plan that my husband had, he has Denver Health, Medicare, and they just sent some things that you can get over, like medical equipment and stuff like that. And the Fitbit was on there. But I'm sure other insurances do too, have different things that you can order.
Great. Thank you very much.
I've been using 8 years PAH. I've been using oximeters for a long time to make sure my oxygen stays saturated. I got an iPhone and I noticed it has, this last issue has oxygen on it. So when I'm in the rehab lab or something and they're taking my oxygen with the medical oxygen saturation, they get a reading and I get a reading. My reading's usually 1 or 2 off of what they're reading. Most medical people I've run into won't take the reliability of what I'm reading off my watch, but I'm pretty comfortable with it with my exercise and all. If it goes below 90, then I increase my oxygen. How do you feel about the reliability of this compared to, say, an oximeter?
So I think that you're bringing up a really good point. I think 1 or 2 percentage points is not a big deal, big difference. We see that just from one finger pulse oximeter to the next. So that's pretty standard, that difference that you're describing. The pulse oximeter in the iPhone is apparently taken from Masimo, which they were the ones to really develop pulse oximetry. So it should be pretty darn good quality, as the Masimo watch should be too. I don't know about the Oura Ring, but what the quality of that one is, but I think it's probably pretty good. So while nobody's going to really take that, and the reason they're not going to take it is because these devices are not FDA approved. They're not medical grade devices, even though they might be giving you medical grade information. They haven't gone through the process. And most of these companies sell more of these to the general public and it's not they don't think it's worth it for them to go through the process of getting something approved. And an exception to that is Spire Health, whose tags on the underwear are FDA approved, but that's not something that's really open yet to the public. Sure.
Thank you for your work, and thank you for talking about this during this conference. I use my Garmin Phoenix 4 as like a daily, tool every day, all day. I've been dealing with hypoxia for my whole life. I'm 41 years old, and I didn't know that what was happening to my body was low oxygen levels. Because of this tool, I'm actually able to watch my heart rate 24/7, And a lot of people don't know that your heart rate is actually in correlation to your oxygen levels. So if your heart rate is sky high, it could be because you have low oxygen levels. So I notice when my heart rate, goes above normal, I'll bump up my oxygen, my supplemental oxygen, and then it levels me out to a normal level. I am trying to reach Garmin right now to specialize in a heart and oxygen monitor and not have all these fancy tools, just to help us with chronic illness keep a better eye on things. I'm a firm believer that Garmin helped save my life this last year. My heart rate's been going up to 170. I've been almost passing out, and my doctors have been gaslighting me and telling me I'm fine. When I show them this medical information, it's helped them troubleshoot me drastically. So thank you for bringing this up.
Yeah, I think, yeah, thank you very much. I think as healthcare providers, we're slow on the uptake of these and slow to pay attention to this. So you keep pushing, because I think it's important.
I have a question. With insurance companies focusing on keeping costs down, do you ever foresee a AI type of program that you participate in where they are directly in contact with you? They see your metrics changing and they would call you to prevent you from going into exasperation of your disease to save money.
I think so. I think that's just around, that kind of thing is just around the corner. It really would be pretty easy. I think, you're looking for a change in heart rate, respiratory rate, activity level, sleep quality, things along those lines. Those can be analyzed and very simple output can say abnormal, into what level. And then, of course, the trick is, well, what is it? And now, that can be handled by pushing out a few questions to somebody, to their phone. That'll be tried for sure, but it's really human interaction at that point. The key is to have information that really correlates with something happening, so that people don't make, out of 100 calls, you want 90 of them to be something really, really important, instead of 100 calls and 10 are really important. That's not sustainable from a cost or time perspective. But I do think AI would help all those kinds of things in a good way.
First of all, thank you, Dr. Vandivier. I'm French speaker. My question to you, I never smoke. I work as a nurse for a long time. So my question to you is how about the people, it's not for me, but people who smoke marijuana or vapor, do they damage their lung?
So all that is really important. With marijuana smoking, the data have not been as conclusive that long-term marijuana use leads to chronic lung disease. But I think we're a long way out from having good data. Now that it's legalized here, we'll be able to do much better studies. So I wouldn't say one way or another about that. And vaping, I think, we have to let those kids, get 30, 40 years older and see what really happens to them to have a good, strong idea. But I think that there's a good chance that anything you put into your lung like that, loaded with nicotine, loaded with oils that shouldn't be in your lung, is it going to cause a problem? I think so. Yeah.
When will the Spire device be available to people like us?
So right now, what they're really trying to do with this is get it out through insurance companies, and get it out through physician offices and things like that, to contract with them to do it. And which is the most important thing, because if you get the data, you want to know what to do with the data. You don't want to get a bunch of data at home and say, gosh, does this mean something or not? And you're constantly going to be second guessing it. So I just know that they're working hard to try to get the uptake increased among practices. So I can't really tell you, but I hope it's soon.
Hello, longtime listener, first time caller. Thank you for coming and speaking with us today. I was raised by a respiratory therapist, this guy. I'm actually a dental hygienist, so it's a very
Say it again. You're what now?
dental hygienist.
Okay.
So brushing is kind of important. I just want to throw you under the bus on that. Okay, it's most of my doctors that are in my chair that aren't taking great care. Not to gaslight
Whoops.
you. Oh, so
Thank you for those comments.
my question.
Now move on quickly, would you?
Really, I just wanted to say as a different part of healthcare providing, namely, I'm in the mouth. So making sure that patients are actually using their devices properly is a huge part of my job. Like I'm looking at the palate constantly. We're seeing thrush, all of that fun stuff. So thank you for mentioning that.
Well,
because it's
so
huge.
just to be clear, I actually think brushing teeth and flossing is incredibly important, and I won't use the word, but something about it to do it because, as you know, it's related to systemic inflammation, to heart disease, and a bunch of other things I probably don't know about as much as I should. So it's actually really important. I keep telling my 13-year-old son that too.
They don't listen. It's fine. I didn't start flossing until I was 19. Sorry, Dad. My other question for you was, obviously we've already discussed the vaping. I'm constantly doing smoking cessation. It's the uprise in smoking right now is insane. I don't even understand it. The fact that cigarettes are now $9-10 a pack is insane. But are you noticing cases of third-hand smoke as well?
So that's a really good question, and I don't really ask that question as much as I probably should. So I don't think I would see it. And I do research with an organization called Flight Attendant Medical Research Institute. And one of the things that they did, and I was part of, was a paper on asking the right questions and to getting in questions about secondhand smoke exposure and people asking that, because you can't actually analyze any data unless somebody has answered that particular question. And the same comes down to third-hand smoke that you might get off of clothes or furniture or whatever it is. So I think that could easily be a big problem. But I can't tell you that I see more of it or less of it, because I'm guilty as charged. I don't ask about it enough.
Hi, I'm Dr. Krista Ebert Santos. I was invited here by Chantel, who came to my clinic in Frisco at 9,000 feet, where I put people on oxygen every day. But just to follow up that last question, when we are interviewing families and asking about smoke exposure, they always say, the few that do smoke at 9,000 feet, yeah, my husband smokes, but he only smokes in the garage. What should I make of that?
It's better than smoking in the house, I'd say, but I think there's a real good chance that's still an important issue. If for no other reason, because when they come back in, you're going to smell it, and what you smell is going to irritate your lungs and could easily lead to an exacerbation or increased coughing and things like that. So I think I would say if you can smell it, it's a problem. So I really want to thank you all. This has just really been enjoyable. I appreciate your input.